DID is not a weakness, but rather an extremely strong desire to stay alive. This is a quote by Dr. Bill Thomas. The DSM-5 describes dissociative identity disorder as a disruption of identity or two or more distinct personality states, according to psychiatryonline.org. Today I'm going to dig deeper in the effects that DID has on daily living, the etiology of the disorder, and the possible treatments. To begin, I'd like to start out with a case study I found on the U.S. National Library of Medicine, including a 55-year-old Caucasian female who was suffering from dissociative identity disorder. We'll call her Mary. In this study, Mary has had a history of substance abuse and comorbid bipolar disorder. She had reported feeling more than one personality inside of her body when she was under any emotional stress or abusing any substance such as cocaine or marijuana. Mary spoke of 3 alters, one of which including a 7-year-old girl, a female teenager, and a male close to Mary's age, around his mid-50s. She further informed the case study that the 7-year-old acted according to age, crying when she did not receive what she wanted, throwing tantrums, and taking frequent naps throughout the day. The second alter that Mary mentioned was the teenager. The teenager dressed provocatively as if she was 16 years old. Mary's substance abuse increased when she was in this alter, and she also inflicted self-harm. The third alter that Mary mentioned was the male, who had a perception of male genitalia, dressed in male clothing, and had the opposite sexual behavior as Mary. She informed the case study that throughout these transitions to the altar, she became violent and suicidal, and she also became homicidal to the people around her, even the people she trusted most, such as her loved ones, family, and friends. According to PubMed.gov, in a study conducted in North America, out of 236 cases of people with dissociative identity disorder, 72% of those cases attempted suicide. With the correlation of major depression and dissociative identity disorder, you could imagine the major adjustment for the individuals with DID and the family members. Those individuals with DID may feel embarrassed after an episode of transition and try to disconnect from their family members in an attempt to save those from themselves. Sudden transitions to alters may negatively affect things like performance in the workplace, social functions, and family gatherings. Referring to Mary's case study, under any emotional stress or substance abuse, Mary may possibly revert to one of her alters, and in doing so may cause harm to anyone around her, like her family and friends. With this being said, you can imagine the difficulty that someone with dissociative identity disorder may face when it comes to completing daily tasks. Although there is much skepticism as to why a patient may develop dissociative identity disorder, the Merck manual states that it usually occurs when there's overwhelming stress or trauma. Some examples of these may be early loss, like a loss of a parent, a sibling, a loved one, or a caretaker, or a traumatic experience. Another example may be a form of abuse, any form, such as sexual, emotional, or physical. According to the U.S. National Library of Medicine, memory and construction of self-identity are cognitive processes that appear markedly and centrally disrupted in DID. This meaning that throughout the age process, the self-identity was never fully developed. Furthering in that article from the National Library of Medicine, dissociative identities have origin in memories of experienced events. This meaning that the development of an alter could occur at any time throughout traumatic experiences in life. Other things that may affect the etiology of dissociative identity disorder may be the family environment and the society that one surrounds themselves in. DID may surface from the occurrence of denial, boundary violation, paranoia, and narcissism. According to the Cleveland Clinic, there are many treatments that someone with dissociative identity disorder can undergo to help ease these symptoms. These treatments aim to ensure safety and comfort for people who have dissociative identity disorder, and they also try to connect each personality into one being in these treatments. For instance, some of these treatments that these people may go through is psychotherapy, which is a talk therapy in a safe place for someone with dissociative identity disorder to talk about the difficulties in their daily lives. Another example of a treatment may be CBT, cognitive behavioral therapy, where a therapist or a psychologist may help you remodel and change your thinking pattern. The third example of a treatment would be DBT, dialectic behavioral therapy. This is a therapy for severe personality disorders. On the pharmaceutical side of medication and treatment for dissociative identity disorder, some psychiatrists may prescribe an antidepressant or an anti-anxiety medicine to help ease the symptoms of dissociative identity disorder. Unfortunately, there is no significant medicine that is created to help treat the disorder of dissociative identity disorder. Although DID is fairly new, there's a lot of research going around, and there is a lot of things that we are learning for this disorder in hopes that we are getting new outlooks and treatments on how to help individuals with DID. Today I've talked about the daily living and the effects that dissociative identity disorder has on an individual, the etiology and how DID starts in an individual, and the possible treatments that one can undergo to help ease the symptoms. Thank you.